I am Daniel Benjamin. I'm the president of the American Academy. I'm really pleased to welcome you to tonight's Bear Lecture entitled Ending the Forever Pandemic of Global Tobacco, which will be delivered by Dr. Howard Koh. For those of you who weren't here for the lecture Howard presented last fall, I just want to let you know the Bear Fellowship, or BIA Fellowship in Health and Biotech, is one of the newest additions to the American Academy's fellowship program. And with this new fellowship, the Academy aims to promote innovation in health and biotech and to support the transatlantic dialogue involving leaders from the academic, corporate, political, and public sector communities. Each year, the Academy will bring a top practitioner or scholar, and in this case, we have both in a single individual, from the United States to Germany. I want to take this opportunity to thank BIA AG, not only for generously supporting this fellowship and making tonight's event possible, but for supporting the Academy's work for almost 20 years. As the Academy relies on non-governmental funding, this support is absolutely crucial in order for us to produce top quality programming. And by top quality programming, I mean programming that brings people like Howard Koh to Berlin to be the American Academy's inaugural Beyer Fellow in Health and Biotech. Now, Howard Koh is the Harvey V. Feinberg Professor of the Practice of Public Health Leadership at the Harvard T.H. Chan School of Public Health and at the Harvard Kennedy School. At Harvard, he also co-chairs the Harvard Advanced Leadership Initiative and serves as the inaugural chair of the Chan School of Public Health's Initiative on Health and Homelessness. Howard has earned board certification in 4 medical fields, including internal medicine, hematology, medical oncology, and dermatology, as well as a master's in public health. Having had Howard here last fall, let me just say that his CV is just way too long and somewhat, exhausting because he's so accomplished. From 2009 to 2014, Professor Koh served under President Barack Obama as the Assistant Secretary for Health at the United States Department of Health and Human Services. In this position, this is the really wearying part. He oversaw 12 core public health offices, including the Office of the Surgeon General, the U.S. Public Health Service Commission Corps, 10 regional health offices, and 10 presidential and secretarial advisory committees. Was there a direct report for each one? Oh, my God. As some of you may know, Howard has divided his fellowship at the Academy into 2 components, one last fall, one this spring. And since he was here last fall, I know that Howard was a great public servant and bureaucrat because during his visit, he approached the meetings we set up for him as a competitive sport and may have had more meetings with an array of truly distinguished people in all parts of Berlin than anyone in a similar period of time. He had meeting after meeting. He never wavered. He never faltered. So I am quite confident in my judgment that Howard was a truly great assistant secretary. During that time, he was the public health advisor, the senior public health advisor to the HHS secretary. He oversaw Healthy People 2020, the nation's public health agenda. He promoted disease prevention, public health dimensions of the Affordable Care Act. He advanced outreach to enroll underserved and minority populations. He helped to coordinate the federal response during the 2009 H1N1 pandemic, and he was the primary architect of landmark HHS strategic plans for tobacco control, for dealing with health disparities, and for chronic hepatitis. Professor Koh has published over 300 articles in the medical and public health literature. He's earned over 70 awards and honors for interdisciplinary accomplishments in medicine and public health, and 6 honorary doctorates. I could go on. But I will stop here and simply say that Howard is not just a physician, he is an extraordinary public health advocate and someone who has never taken his eye off the big picture. And because he has kept his eye on the question of what are the biggest factors affecting public health, he has spent his career on a major cause of preventable illness, tobacco, which for over 100 years has wreaked enormous havoc on the health of our communities and caused human suffering around the world. Before I hand the microphone over to Professor Koh, though, let me just briefly explain how we will proceed tonight. Howard will deliver his talk. For those of you who are at home in the Zoom audience, you can start asking questions at any time. Please put them in the Q&A section of the Zoom panel in front of you. You can start right now, as far as I'm concerned. For those who are here in the audience, you can raise your hand. Those at home, please don't raise your hands. No one's looking. And we apologize in advance if we can't get to all of the questions. And now, please join me in welcoming Howard Koh.
Thank you so much, President Benjamin. What a wonderful introduction. And I am so honored and delighted to be back here at the American Academy in Berlin. As Dan mentioned, I arrived here for the first time last fall, had a glorious several weeks, and absolutely loved it. And so coming back this time, I feel so much at home. And it's just a really great honor to be the inaugural Bayer Fellow in Health and Biotech here at the American Academy. I love the mission of this organization, and the people I've met both last time and this time have been absolutely fascinating. So thank you so much for having me. Before I begin formally, I do want to thank not only Dan, but his fantastic team. Barrett Aber, who I think is here somewhere. There she is. The wonderful, wonderful Caitlin Hahn, who has set up all these meetings for me. Thank you. Matthias, Gabby, who makes me eggs every morning. I mean, it's just a wonderful group of people, make you feel so much at home. I want to thank Bayer AG and Stefan Ulrich and Oliver Renner. I think Oliver is here, maybe not, for making the fellowship possible. And then because of Caitlin, I've met so many leaders of health here in Germany and the EU, and a number of them are here tonight, real experts for global public health. So thank you so much, colleagues, for being here. So last fall when I came, I spoke about the COVID pandemic that's engulfed the world for 2.5 years. But tonight I decided to talk about the forever pandemic of global tobacco that's engulfed the world for well over a century. And I'm presenting this topic for a number of reasons. First, it's affected millions and billions of lives, not just those directly affected, but family members too. For example, if you wish to raise your hand, I'm just kind of curious, how many of you here have had a friend or loved one or relative suffer from tobacco dependence? Can people want to raise their hand? Okay, so this is not surprising. About a third of you, about a half of you raised your hand. This is the situation we face globally, year in, year out, for far too long. And so if you take a historical point of view, this is a terrible, terrible part of our human history that we need to address. And then on a very personal note, as Dan mentioned, I trained in multiple fields and started my career as a clinical oncologist, determined to cure everybody of cancer that I met as a practicing physician. And on one hand, that was very rewarding to offer care to individual patients, but very early on, I saw too many of my patients suffering preventable suffering and dying preventable death due to tobacco addiction and dependence. And quite honestly, it was that type of experience that started my public health journey. When I saw patient after patient who was suffering and dying from tobacco dependence, and now later on I can understand it's from many other preventable causes as well, including COVID, I started asking myself, isn't there a broader, more inclusive, and perhaps even more impactful way of keeping people as healthy as possible? So what I'm going to do tonight is address this forever pandemic, take a very broad global view, focus particularly on the United States, but this is going to be very global. And I'm going to make it pretty personal because this is the issue that changed my life personally and helped me move from the clinical setting, where I saw patients for several decades, actually, to now public health and this fascinating world where I get to join all of you here in Berlin. So let's begin. This is a saying from the WHO that's about 75 years old that is engraved in 7 languages in the concrete of the exterior of the Harvard Chan School of Public Health. If you come to Boston and visit our school, this WHO saying is engraved, literally engraved in the concrete of our building. Quote, "The enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being." And I love that quote. I love that phrase, the highest attainable standard of health. And to me, that means that your good health is a gift. And if you reach your highest attainable standard of health, that's public health success. That's fantastic. So let me just stop here and ask you, are you living your highest attainable standard of health? If you are, congratulations. You're a public health success. But if you're not, the next question is, why not? What can you do about it? What can we do about it? What can we do as a human global community together? That's basically what public health is all about. So I first started thinking about this when, again, I started my career as a young oncologist taking care of my cancer patients, and I saw very early on too many dying of tobacco-related cancers. So back in my training, I started looking at graphs like this, asking, what are the leading causes of cancer death in women? So we have many very important causes of cancer death in women here. And the good news is for many of these, the trends are going the right way over time. And so we see breast cancer, and those death rates are going down. Let's see if this is going, okay, colorectal cancer, uterine cancer, stomach cancer, pancreatic's going up, unfortunately. But what's very disturbing is the line for lung cancer looks like this, all right? And if you look at this map, the best cancer tracking systems in the U.S. started tracking data from about 1930 on. And if you just look at this for a couple of minutes, it tells you a very important snapshot about the history of cancer and therefore tobacco in the U.S. If you look at the history, cigarettes were invented in the late 1800s, around 1900 or so. People started using it in our country and around the world. And with use, all of a sudden you start seeing the rise of this cancer, which is initially pretty uncommon, then started rising and rising. I'll never forget in around 1990 when it passed breast cancer as leading cause of cancer death in women. That was a big headline, and I was still in training then. All of you know that breast cancer is a cancer that's feared by women. To have lung cancer surpass it is very, very striking. And then what about for men? If you look at the graphs like this, again, there are very important trends in terms of key cancers in men, prostate, colorectal, others here. But the line for lung cancer looks like this. And the same trends, again, it starts very low level and then hits this peak. And now the only good thing about this line is it's starting to go down as for men and women. And how do you explain it? Well, as you probably all remember, the key historic Surgeon General's report linking tobacco to terrible human outcomes, particularly cancer, was announced in 1964. And then so the scientific news was released around then, and then it took about 20 years for the impact of public health interventions to start taking effect. There have also been, of course, excellent progress in treatment of lung cancer, targeted therapies and immunotherapies, and also surgical advances as well. You add it all up, and the good news is that lung cancer death rates are going down. But even as of right now, the leading cause of cancer death in the United States in men is lung. The leading cause of cancer death in women is lung, and close to 90% of this is preventable because it is due to tobacco dependence. So if you take a big step back, in the 20th century, some 100 million people died from tobacco dependence, most of them in high-income countries. And the projections are for the 21st century, that number will be more like 1 billion, as you can see over on the right. But the impact will disproportionately hit low and middle income countries. So when you start looking at graphs and figures like this, you say to yourself, okay, if we're serious about prevention and public health, this is the issue we have to tackle, and we have to tackle it together. So this started my journey in this whole area. And let me explain this very personal slide of the 1990s, one slide describing the 1990s, and spend a couple of minutes on it, because the first effort, the 1992 Massachusetts Tobacco Tax Initiative, is one that changed my life. At the time, I was a volunteer for the American Cancer Society. I had completed my training. I was working at a Boston medical center seeing patients. And the state chapter of the American Cancer Society decided to have a campaign to try to convince Massachusetts voters to go to the poll in a ballot initiative and vote in support of a 25-cent tax increase per pack of cigarettes. And the rationale was if you increase the price, consumption drops. That's been very well studied by health economists, and also generates potentially millions of dollars that could be used for public health and tobacco control. So I joined this volunteer effort back then, and it was, in hindsight, the most astonishing political experience that a young doctor like me could have. We did outreach, we did press, we were outspent by the tobacco industry 10-1. They formed an opposition committee called the Committee Against Unfair Taxation, completely funded by the tobacco industry. So it was a pitched battle down to the end. In the middle, you see the bumper sticker that was created for that, which is vote yes on question 1, tax tobacco, protect kids. And I'll never forget being in the strategy meetings where some of our political advisors said the tobacco industry is some of the most despised businesses in our state and our country, but protecting kids is something that everybody wants to do. So let's put it together in a bumper sticker so that people understand what we're trying to do. No one likes to talk about tax increases, but in this case, if you generate millions of dollars for public health and tobacco control and you protect kids, it might be worth it. So what I just described to you in a minute or two was a year and a half of a campaign. We were successful, we were joyous, but then a lot of that money coming in started being diverted away for other purposes. So I got even more involved after the initiative was successful, became chairman of that coalition, in fact, and then over time was spending more time at the State House begging our budget leaders not to divert the money away, but keep the money for tobacco control the way the voters wanted. And then the next thing I knew, the governor of Massachusetts noticed me and appointed me commissioner of public health and changed my life. So one day I was involved in this advocacy and seeing patients. The next day I was the commissioner for a state health department of some 3,000 people, 4 hospitals, a $700 million budget, and just a little bit of politics. So that was a big transition for me. Over on the right, what I'm very proud to show is that we did have, at the time, one of the most vibrant anti-tobacco programs in the country with media and outreach and education and counter-advertising. I'll show you some examples of that. And our decline in cigarette consumption in Massachusetts, you can see the bottom line, the steepness of the decline was greater than what we saw nationwide. So that was something very striking. And in fact, that whole effort was so transformative for me personally that I ended up writing it up in one of my, in this article that came out in the journal Tobacco Control, analysis of the successful 1992 Massachusetts Tobacco Tax Initiative. And that sort of started my journey on policy now, 30 years ago. I cannot believe it. 1998 was also a huge historic landmark for the world because at that time, all the U.S. attorneys general sued the tobacco industry to recoup Medicaid costs due to tobacco-related illness, and they settled the master settlement agreement where the tobacco industry was required to pay over $200 billion over 25 years. So huge step forward. And if I can say, that whole initiative was led by Mississippi Attorney General Michael Moore, who has since become a very good friend. One of the outcomes of that settlement was to set up a national foundation for prevention of tobacco use and now called the Truth Initiative, and I have the great honor of serving on that board with Mike Moore as the chair. By the way, if you want a real hero in public health law, Mike has gone on to help sue the opioid industry lately, and you're hearing a lot about that with Purdue Pharma in the news. So that was the 1990s. And then all of a sudden, I got appointed to be the Assistant Secretary for Health, as Dan summarized, another astonishing life experience for me. And so got to serve for 5 years, 5.5 years at Health and Human Services under Secretary Sebelius. When I started, H1N1 was taking over the world, and that was a great worry back then. So got my pandemic experience in the trenches back then. And of course, we're going through COVID now, 2.5 years and counting. Number of years later, had the incredible privilege of meeting the president and the then vice president, now President Biden. And then, of course, as a Korean American, to help represent the United States at the World Health Assembly was an incredible, incredible honor. So these experiences change your life, but also help you think about health from the broadest point of view. So where are we right now with the tobacco pandemic? You can look at graph after graph and make some big picture comments. But right now we can say that over 1 billion people smoke some form of tobacco around the world, with smoking rates much higher in men on average than women, over 30% for men, about 7% for women. In the U.S., it's lower than the global average, as you can see here, about 12, 13%. The differential between men and women is not so big in the U.S. But you can glance and see there are hot spots in Europe, in Southeast Asia. And then if you look at maps for the death rate from smoking in 2019, about 15 to 20% of all global deaths are due to smoking or tobacco. A huge problem in Eastern Europe and in Asia and in Russia, as you can see here. And if I can say, as a Korean American, I am too familiar with this burden in Asia. What the industry has done is made having cigarettes offered to one another a typical part of what you do when you're a businessman in places like Korea and Japan and China. And I've had too many relatives of mine suffer and die too early from tobacco dependence, if I can say. So when you stop and think about it, here we have a cigarette which looks perfectly innocent. You don't think much about it, but this has been the topic of a lot of research, decades of research by tobacco industry scientists, to make this a very efficient nicotine delivery device. And I just want to stress the terminology, which is going to be very important to this talk. It is a combustible nicotine delivery device. That means you light it on fire, and when you do, you burn the tobacco, and it releases all these chemicals over on the right, dozens of carcinogens, about 60 by last count. And by the way, this is not an accident, because this delivery device is being tweaked and modified all the time. There are filters in there to ease the smoke going into your lungs and make it more tolerable. There are flavors in there to make it a more pleasant user experience, including menthol. And I'm going to be saying a lot about that because there's a big announcement about menthol just last week in the US. Bronchodilators to make this easier to go into your lungs. And then, of course, very importantly, nicotine, the key part of all this, which is addictive. And the big question is, how do we handle the nicotine challenge in combustible nicotine delivery devices and then non-combustible ones like e-cigarettes, which I'll be talking about in a couple of minutes. So a big question here is, if we know how deadly this is, if we know how addictive this is, if we know how this has devastated lives for over a century, how does this keep getting sold from a business point of view? So there are many ways to answer that. But one major strategy here, which you cannot underestimate, is the power of advertising. And I've heard a number of fascinating presentations about advertising. We've all seen these ads, don't think about it very much. There are thousands, millions of them that you can explore and study and discuss. But let me just show a couple of them. And the advertising is either overt or covert. It's explicit or implicit. There's always a message being sent, whether you realize it or not. So over on the left, look at this older ad from Benson and Hedges. Smokers are literally wrapped around the Statue of Liberty. Not so subtle message. This is a question of freedom. Don't interfere with my freedom. And over on the right for this audience, a German version of that. Immer frei, right? Always free. And then I've also heard lectures from media experts and advertising experts that because the tobacco industry can't say that they're offering something that's going to make you healthy, what they do instead is offer you through these ads the picture of health. The picture of health. So look at this middle ad in here through Parliament. Beautiful beach, wonderful sunshine, these palm trees, two little people there you can barely see, no cigarettes anywhere in sight, but it's beautiful. It's a picture of health. And this is the way they send the message day in, day out, year in, year out, decade in and decade out. A lot of attention to advertising. So if we do public health right, we have to realize they are trying to normalize and glamorize use, and we have to counter that. And there have been some great examples of how to counter that I'm going to be showing you through this talk. So as I entered the Obama administration, I had the incredible privilege of making this a high priority for me as the Assistant Secretary for Health. By the way, everything in DC is an acronym, so at HHS, Health and Human Services, I was called the ASH, the Assistant Secretary for Health. And for one to be involved in tobacco control to be called the ASH was a little ironic, if I can say. So what happened during my time there? Well, first and foremost, the Family Smoking Prevention Tobacco Control Act was signed into law. And what did that do? It granted the U.S. Food and Drug Administration, FDA, to regulate tobacco for the first time in U.S. history. So if you stop and think about it, for years we would say in the U.S., I would say to my students, the D in FDA stands for drug. Here we have nicotine, one of the most addictive drugs out there. The FDA didn't regulate it until June 22nd, 2009. And what this act also did was ban flavors in cigarettes, except for menthol. Again, more on menthol later. And by the regulation, FDA could now oversee reduction of nicotine levels in cigarettes, but not to zero. And this whole historic effort happened on June 22nd, 2009, signed by President Obama in the Rose Garden. And I remember June 22nd, 2009 so clearly because it was my first day at work. I'd been nominated to be the ASH by the president. I moved out of my house, I left Harvard, I turned over all my grants, I moved down to DC. My son was vacating his studio, he moved out, I moved in. I was ready for Senate confirmation. On June 19th, Friday, I got the call, Howard, congratulations, you've been confirmed by the Senate, please report to work on Monday. So June 22nd, I reported to work, I raised my right hand, I got sworn in, I said, okay, I'm the official ASH, now what? And they said, well, your first job is to go to the White House because the president is signing the Family Smoking Prevention Tobacco Control Act into law, giving the FDA authority to regulate tobacco for the first time in U.S. history. And I said, what? That's the very first thing I'm doing on my very first day? And some of you may have heard that I gave a little talk last week on spirituality and how some people say, okay, these things happen to you, they're an accident, this is serendipity, but I don't know. I'm not sure that was serendipity for me. You know, I got there were literally 200 people in the Rose Garden. I knew about half of them because they were colleagues I've been working with for so long. And so somehow it felt like it was all meant to be. And to have finally some regulatory authority over the tobacco industry was something that I knew was historic. Speaking about history, in 2014, we celebrated the 50th anniversary of the landmark Surgeon General's report. So here I am on the right at the White House with Secretary Sebelius overseeing this press conference. The acting Surgeon General then was Boris Lushniak, who's a wonderful tobacco control leader. And so during my time there, this was an issue that was very high priority for me. We had the first ever HHS strategic plan on tobacco control, leveraging the new authority of the FDA, having CDC and FDA and NIH all work together. It was just an astonishing time. So that's the national perspective, but if you look globally, What has the world done to try to practice tobacco control with the best evidence possible? Many of you are very familiar with the debates going on with the WHO. How can the WHO be more empowered to be as effective as possible in collaboration through this COVID-19 pandemic? Very important discussions. The next session of the World Health Assembly is coming up in a couple of weeks in Geneva. But if you look at the history of WHO action, the Framework Convention on Tobacco Control is in some ways the premier example of how countries and states can work together to try to tackle a public health issue, in this case, tobacco. So they developed a so-called Empower framework adopted in 2003. Over 180 states have now signed on. The Empower stands for Monitoring Tobacco Use and Prevention. If you're serious about this as a nation, you should be tracking the appropriate data. P, protecting people from tobacco smoke, because it's not just direct use, but secondhand smoke in public places can be a challenge. O, offering help to quit tobacco use. And so one thing to note is that if you talk to people who smoke, the vast majority of them do not want to continue. They know that they're hooked and they want to stop. Cessation can help some of them, but certainly not all of them. And so they're looking for help, and can we give them the best interventions possible with counseling and nicotine replacement therapy and quit lines and things like that. We can warn about the dangers of tobacco. This is where the counter-advertising is important. Deglamorizing and denormalizing use. Enforcing bans on advertising, and then raising taxes on tobacco. This is how I got involved, and can we do this more nationally? So let me just quickly run through these, where we are, monitoring tobacco use and prevention policies. The good news is, over time, since the Framework Convention on Tobacco Control was started, we have now some 145 countries and more tracking outcomes and data and trying to see what trends are for the use of tobacco in over some 5 billion people around the world. So that's steady progress. In terms of protecting people from tobacco smoke, we now understand that having clean air in places like this should be the norm for health. And if we had come here, a generation or 2 generations ago, maybe many people in an audience like this would be smoking, but we should claim the norm back from the tobacco industry and have clean air be the norm. So I'll never forget when 2004, Ireland, of all places, became the first nation to have all smoke-free indoor public places. So that means in workplaces, in restaurants, and pubs. And pubs. And pubs. The first time I heard it, I couldn't believe it. I said, what? You can't walk into a pub and not see cigarette smoke. And then I thought, wait a minute. That's the tobacco industry, again, changing the norm, saying, oh, that should be just perfectly part of the norm. So Ireland took that global lead in 2004. My colleagues and I wrote this little piece in the New England Journal called Making Smoking History Worldwide. And, at first we said it seemed impossible at first. That was the first line. But it was possible in 2004. So since then, it's been fascinating to track how many other nations have made all smoke-free indoor public places throughout the whole country. And this is what the map looks like now, some 18 years later, over almost 2 billion people in some 67 countries where legislation is at a best practice level. Look at all of South America now has smoke-free public places, and Canada, for example, Australia, but I'm going to keep talking about Australia because they've been an incredible leader. So that's incredible progress in 18 years. And again, it changes the norm back. In public places, smoking is not permitted, okay? And then the O, offer help to quit tobacco use. This means, can you have national quit lines, coverage for nicotine replacement therapy, oral therapy, other cessation services. Over on the right, again, the vast majority of U.S. cigarette smokers want to quit. They want help, but doing this unassisted has relatively low quit attempts. If you add in medication that's FDA approved and counseling, it improves cessation rates by 2 or 3 times, but we need much, much more. And then the W, warning about the dangers of tobacco. Again, the whole theme here is to change the social norm, take it back from the tobacco industry, deglamorize and denormalize use. So here's an ad, I smoke for taste, but the California Tobacco Control Program, it's been very aggressive and out front for decades, had an ad running in their state, Bob, I've got emphysema, okay? Just change the norm back and reflect what the reality is, which the tobacco industry would like you to overlook. And so when I was there, I was very proud that about 10 years ago, the Centers for Disease Control, CDC, started putting out 30-second ads from former smokers. It's called the Tips from Former Smokers campaign. It features real live people who are very courageous about going public with their level of suffering. You may have seen all these ads on TV. I have one for you now, and this is very graphic, so get ready. And some people object that it's so graphic, but this is what people are going through in hospitals, not only in the U.S., but everywhere. So this is a tip from Terry.
I'm Mary, and I used to be a smoker. I want to give you some tips about getting ready in the morning. Learn your name. Then wig. Then your head redefined. And now you're ready for the day.
So these have been running for 10 years and counting. By the way, when you have the privilege of being a state health commissioner or an assistant secretary, you have many meetings with media outlets who are running tentative ads past you and asking for your reactions as a health professional. You know, we have focus group testing, lots of conversations about strategy and how explicit to be, those sorts of just fascinating stuff. But the really important theme is that for each of these, you have to evaluate it, because there's always going to be somebody who says, I don't like that ad, take that one off, that's a waste of taxpayer money. So when you do these campaigns at a national level, you have to have the evaluation back up. These tips from former smokers campaigns have been very well evaluated. When these ads run, the calls to the quit lines go up, people report quit attempts going up. It's been published in Lancet and other very prestigious journals. So in my view, and by the way, just a couple of weeks ago in New England Journal, Bob Bazell, Dr. Barry Bloom, and I co-wrote something saying some of these strategies from tobacco maybe could be used for vaccination now. Make vaccination the norm, just like non-smoking should be the norm. Is that one broad strategy where one area of public health can inform another? And then back to the warning theme, you know that over time, people in public health have gotten very restless saying those little warnings, typed warnings on the side that no one can read aren't particularly effective. Shouldn't they be more graphic, more realistic, with pictures covering large parts of both the front and back of the pack? In 2012, I'll never forget being in a press conference with the Secretary and the FDA Commissioner, Peggy Hamburg, where the U.S. proposed to have graphic warning labels on U.S. cigarettes. It was an astonishing event that I'll never forget. And guess what? We got sued by the tobacco industry. Nothing happened. So in the U.S., we still do not have graphic warning labels. But here in the EU, you do. And now in 2021, there are graphic warning labels in place for almost 5 billion people in some 101 countries. So follow that. That's moving forward. And then the E in the Empower is to enforce bans on tobacco advertising. And you can have bans on TV or radio or print or all the above. If you do it well, like in some parts of the world, you get a blue color on here. The U.S. has a pretty good record, but not as robust as other countries. And so that's being tracked by the Framework Convention as well. But again, I said to you that the industry is always trying to send their message, whether it's explicit or implicit, overt or covert. And let me just give you the next best example. And this is a little clip from the Cancer Research Organization in the UK talking to a bunch of kids. And the title of this little clip is called "The Answer is Plain."
I like this one because it's got red, and red is my favourite colour.
It reminds me of a Ferrari.
It stands out from the crowd.
Like funky, sort of, with design.
It looks kind of like the sun, all that light coming from one single place.
This is quite
fancy. There's a programme I've watched called Tintin, and it's got a symbol like that in one of the films.
Is that a royal sign?
It might be posh writing. Yeah, it looks quite posh.
It's really bright colours, and then I think it would be quite fun to play with because, like, it just makes you almost happy by looking at it.
I think this one looks actually quite pretty. Yeah, pink, pink, pink.
It looks girly, I just like it.
The pictures actually look quite nice. I mean, ice cubes and mint. It makes you feel like you're in a wonderland of happiness.
That one's cool. That one's cool. That one's cool. That one?
Yeah, that was cool.
I've watched this clip about 100 times, and each time I'm so astonished by it because you look at a typical cigarette pack and you don't think twice about it, but it's sending these messages to kids, and the kids are finding it fascinating, and it's something that they're attracted to, and they like the pink colors and that sort of thing. So if you're leaders in Australia, you say, okay, we're tired of cigarettes like Marlboro, the leading brand in the world, by the way, looking like this with the chevron that everybody understands and the red and the white. You don't think too much about it, but maybe you should just strip a typical cigarette pack, which is basically advertising in front of you, take it all away and replace it with other graphic images to reduce the appeal of tobacco products. So they insisted on what's called plain packaging of cigarettes in Australia. It led to about a decade-long struggle in courts and the World Trade Organization, but finally in 2020, the WTO upheld plain packaging. So if you buy a pack of cigarettes in Australia or now 15 other countries, it looks like that, okay? It strips away any hint of attraction, and it shows the reality of what this does to human health. So now you have plain packaging in France and Saudi Arabia and Turkey, UK, and Uruguay. By the way, Uruguay, I think there are a couple of members of the Uruguay community here. They've been a wonderful leader in tobacco control. Their former president, Dr. Tabaré Vázquez, was a physician oncologist. He helped make the country smoke-free, one of the first after Ireland did in 2004. So he was a giant in global public health, and I'm delighted to honor his memory in front of all of you tonight. And then the R was to raise taxes on tobacco. That's the experience I lived through in my state. And the share of tobacco retail price that is taxed is particularly high in parts of South America and parts of Europe. And then, again, Australia and New Zealand, by the way, is another great global leader on this whole issue. So if you put all this together from Empower, after almost 20 years of work, what do you see? Well, you see a mixed picture, which is a good segue to the last part of this presentation, which gets very complicated, but if you take a step back, quite fascinating. And that is, on one hand, cigarette consumption is going down per capita. If you look at each of these graphs, let's see if I can get this to work. All right. So for the U.S., starting from 1900, it went up. Now per capita consumption is going down. Let's see if I can follow these lines. It's the same trend for Germany I have here, for Japan, so it's all around the world. So in terms of public health progress, that's good news. But if over on the right, you're the tobacco industry, you get a little concerned because over on the right, you see in red that total sales is going down. For the time being, in blue, they've been able to keep up their profits and their market value. And if you look to see what it is, it's somewhere between 700, 800 billion, maybe more. They're especially increasing their market share in places like Asia. Again, hits home for me as a Korean American. By the way, The last time I was in Korea was 2007, where they asked me to come and speak for a new nicotine research organization being launched to celebrate that male smoking in Korea had dropped below 50% for the first time. 50%. I'll just never forget that. So if you're the tobacco industry and you've relied on these strategies to make so much profit over so long, you say, okay, these trends are starting to disturb me as a business person. What do I do? Well, one thing is you can keep doing outreach to the groups who are your best customers, people of low socioeconomic status. As Dan Benjamin mentioned, I'm the head of a relatively new health and homelessness initiative at our school, and the homeless have astronomical rates of tobacco use. One study in Boston showed it could be about 70% prevalence. Also, people with mental illness and substance use disorders, some estimates in the U.S. are some 40% of U.S. cigarettes are being consumed by people with mental illness or substance use. Communities of color, the African American community has been targeted by the tobacco industry with menthol cigarettes that for reasons I'm never sure I quite understand, is very popular for black Americans. There are higher rates in LGBT groups and in some parts of the military. So one strategy is to keep your outreach going in terms of business with such groups. But another strategy, which gets me to the last part of the talk, and one that's absolutely fascinating and quite controversial now, is looking at so-called non-combustible tobacco products and seeing if they might have a role in what's called harm reduction. So if you've not heard about all this, let me just try to make it as clear as possible. First of all, to remind you, cigarettes are combustible tobacco products. You light it on fire, the tobacco burns, and it releases all these chemicals and products, including tar. But you can have unheated, non-combustible tobacco products that aren't burned on the bottom, left to right. It could be gums, lozenges, snuff, chewing tobacco. Okay, you don't burn those. Or on the top, you can have ones that are heated but not burned. It's a very big difference because some would say if you use e-cigarettes, which is the top left box, or electronic nicotine delivery devices, you heat a product that has nicotine in it, but you have much lower levels of toxic chemicals. It's been said that people smoke from the nicotine but die from the tar, and the people who are really promoting e-cigarettes as harm reduction say, okay, well, that sounds very attractive. If people find it impossible to quit, why don't you at least reduce the harm and give them e-cigarettes? So I'm going to have more on that in a second. Over on the right, not to confuse this, but there is a heat not burn tobacco product by Philip Morris called IQOS, I-Q-O-S, and that's getting a lot of attention lately, and I'll be saying more about that in just a second. So let's just say something about harm reduction, because it's a fascinating public health concept that is now being applied potentially to tobacco and gaining a lot of headlines. And if you don't know about this concept, the whole concept is if people are engaging in behaviors that could involve some risk, how do you protect their health as much as possible while they're engaging in those behaviors? So instead of saying, okay, you have two choices, completely stop what you're doing or not, say, well, you can keep engaging in these behaviors, but use this harm reduction intervention. So there are lots of examples here from left to right. Sunscreens. You all know that if you have too much sun exposure, you can get sunburn. Sunscreens could help you continue to be out in the sun without having too much sun damage and risking higher chances of melanoma. I know that actually that's the area that got me involved in cancer and public health in the first place. So next time you invite me back, I'll talk on that. Seat belts, when you're driving, that has some risk. Or riding bikes, if you put on your seat belt or a bike helmet, that's harm reduction. You can keep engaging the behavior and protect your health as much as possible. And then getting more extreme over on the right, if you have an opioid addiction, you can get methadone, as part of medical harm reduction. That usually occurs in highly regulated clinical settings. Or you can have syringe exchange so that people are using drugs, but at least protecting themselves from infectious diseases like hepatitis or HIV. So if you talk about harm reduction in public health, that is an area that's pretty well received, although still quite controversial when you, especially talking about some of these issues over on the right, methadone and syringe exchanges. In public settings, it does invite public discussion. But now we are front and center in the tobacco world about e-cigarettes. Can e-cigarettes be used as a form of harm reduction for people who just cannot stop smoking? Again, this famous quote from Michael Russell in 1976, people smoke for the nicotine but die from the tar. Can we decouple those two? And it appears that exposure to potentially toxic substances from non-combustible e-cigarettes is a lot lower than from combustible tobacco cigarettes, okay? So that's potentially a point in favor. And then a number of studies have been done. Can e-cigarettes help adult smokers as they attempt cessation? And you can argue that strengths and weaknesses of any one study, but this Cochrane review that put all the studies together concluded, in summary, quote, we are moderately confident that nicotine e-cigarettes help more people stop smoking than nicotine replacement therapy, the oral NRT that's been around for a long, long time. However, we need more evidence to be confident about the effects of e-cigarettes, particularly the effects of newer types of e-cigarettes that have much better nicotine delivery than older types. So that's tantalizing, right? Wouldn't it be great if we could get millions of smokers who just cannot stop and at least switch them over to something where they're getting less exposure to potentially toxic substances? So some researchers and advocates have been promoting that potential idea. But the flip side is that as e-cigarettes have become more popular in the U.S., as you all well know, kids have taken this up in dramatic fashion. So over on the left, you see that cigarette use in kids has dropped dramatically, now under 5% in the U.S., so that's really stunning progress. But instead, so many kids are switching to e-cigarettes, that's the line on the right, going up very dramatically. And right now it's projected in the latest studies by the CDC that some 2 million middle and high school kids are using e-cigarettes on a regular basis. So, and if you look at that study, those studies about trends, they show that children and adolescents who use e-cigarettes have doubled their risk of going on to smoking cigarettes. Now, is that cause? I'm not sure if that's cause or not. That's still being debated. Some people say, well, if you're the type of kid who tends to use e-cigarettes, you're probably more likely to go on to cigarettes anyway. So it's an association, not a cause. We can debate that. What's very disturbing is that if you're a high school student using e-cigarettes, the vast majority are using flavored e-cigarettes. So one obvious thought is, why don't we get rid of flavored e-cigarettes? Because it's bringing all these kids into use. Complicating this is that flavored e-cigarettes do help some adults. So what do we do about that? Here's another factoid that's very disturbing, is that some 43% of e-cigarette users as kids say they're using it because I'm feeling, quote, anxious, stressed, or depressed. Lots of issues about the mental health of adolescents in our country right now. And if they turn to e-cigarettes for some relief, it's just making all these issues more difficult. And kids understand that they are getting hooked because nicotine is addictive. And so 2/3 of them who are currently using are seriously considering quitting the use of all products. On the bottom right, just a plethora of flavored e-cigarettes on the market. And until now, virtually unregulated by the Food and Drug Administration. They were not given that authority in 2009, and so now they have to play catch up, and everyone's waiting to see what they're going to do. So if you're concerned about the harm of e-cigarettes, they're highly addictive, they're linked to some negative outcomes with respect to cardiovascular disease, respiratory disease, risk to adolescent brain development up to age 25. In 2020, the world was engulfed in this terrible story about e-cigarette or vaping use associated lung injury, EVALI, that caused almost 3,000 hospitalizations in mostly kids and 68 deaths. Now that it's quieted down, it appears that was due to many of them vaping marijuana and not just nicotine, and having a contamination with something called vitamin E acetate. For adults, a lot of them start in with e-cigarettes to try to quit, and then they're now using both combustible cigarettes and e-cigarettes, what's called dual use, and the long-term health effects are unknown. So that's the situation right now in the U.S. Lots of debate about whether e-cigarettes can be a form of harm reduction. Lots of questions about how it could be potentially useful for adult smokers while trying to protect kids who are taking this up in dramatic fashion. And meanwhile, the advertising is back big time, as you can see here. And the themes are almost what we saw decades ago. You know, take back your freedom, rise from the ashes, appealing to young people over on the right, as you can see here, glamorizing this, as this woman is showing over here on the left. A big question for the Food and Drug Administration now under a new commissioner: how is the U.S. going to regulate this, especially since advertising is pretty much allowed for e-cigarettes, except for a few federal prohibitions? Should we ban flavored e-cigarettes to protect kids? And then how does the Food and Drug Administration now meet the so-called standard of appropriate for the protection of public health, helping adults smokers quit while not endangering youth? So to make this really very, very complicated in the last couple of years, the FDA now has authorized a couple non-combustible products, the IQOS product from Philip Morris, and then last fall, the e-cigarette Voos Solo. They determined, after their considerations, that these were potentially appropriate for the protection of public health. Lots of criticism from the advocates. No e-cigarette has currently been approved by the FDA as a cessation device, so that's clear, but lots of discussion about whether it could or not. And then in the meantime, if you look at the biggest companies with the biggest market share of e-cigarettes in the U.S., Juul, Voos, Phantom Ventures, that's 75% of the e-cigarette market. They are either partially or completely owned by the tobacco industry, as you can see over on the right column. The impact of independent e-cigarette companies is relatively low. So in short, big tobacco has become big nicotine. So what's the tobacco industry done with all this? Well, they see an opportunity. In the middle, you see the explicit statement from Altria, the U.S. Philip Morris company, that they are moving beyond smoking. They're moving from a tobacco company to a tobacco harm reduction company. Well, that sounds wonderful, right? I mean, they want to reduce harm, but the irony, of course, is they want to reduce harm for the people in whom they've created the harm in the first place. They're still selling combustible cigarettes while they're trying to sell these new products in a way to keep their business going. They have new types of ads: unsmoke your party. They want a smoke-free future, they say. And over on the right, with IQOS, they're trying to associate this with cafes and drinking coffee. It's all back to normalizing these products once again. It's literally back to the future. And then as I close, here's something that I just learned in the last 6 to 12 months, which I find very, very disturbing, and that is the major media newspapers in our country, which all banned tobacco advertising years ago, are starting to take tobacco advertising again in what's called paid advertorial. So let me be very explicit about my hometown newspaper, the Boston Globe, a newspaper I respect, has always been excellent on public health. In 1999, when I was commissioner, they announced that they are, for public health reasons, that we're not going to take tobacco advertising money anymore. We all thought that was great. And then it turns out that in the last couple of years, they are accepting paid advertising for Philip Morris. You can see some examples on the left and right. They pay to have these essays about open and transparent science leading to progress, who can be held responsible for stopping misinformation. I mean, that theme is all over the place with the pandemic, right? And if you look in tiny letters in the red box, it says paid for by Philip Morris International, all right? Sometimes they honor these scientists who they feel are really excellent at advancing open and transparent science, and they're featured in these, but they don't realize that it's paid for by the tobacco industry. So when this article came out in Commonwealth magazine just a couple of weeks ago, actually, and I was quoted in it, I mean, scientist after scientist said, why did the tobacco industry do this? I had no idea that they were featuring me in these advertorials. Please take my name out. So they keep going in 2022, and it remains a fascinating, a very dynamic time. So my last two slides is that can we start thinking, as we do all the work with the Framework Convention, using the Empower framework, trying to decide whether e-cigarettes can be a form of harm reduction, holding the industry accountable for claiming they promote harm reduction when in fact they still make combustible cigarettes by the billions, is that can we think about new, bold, and fundamentally different strategies? So one is requiring the tobacco industry to reduce nicotine content in their cigarettes to non-addictive levels. I mean, that's a fascinating concept, one that I personally was involved in lots of internal meetings at Health and Human Services about whether the FDA would move into that direction. In 2017, the then commissioner made an announcement that he and the agency was going to move into this strategy, got a lot of attention, but then he left. No action taken since then. So we're seeing what's going to happen under a new FDA commissioner just announced a couple of months ago, where they're going to revive that effort. There are some efforts in countries around the world, the U.S. and elsewhere, to have what's called a tobacco-free generation. So just prohibit sales of tobacco products to all individuals born in or after a specific year. So in Brookline, Massachusetts, in my home state, it was first proposed that if you're born after January 1, 2000, you will never be allowed to buy cigarettes. We want a tobacco-free generation. This is getting more attention around the world. I understand Denmark is considering something like this. And then my last slide, how about just having what's called Project Sunset, where you abolish tobacco product sales? The Kingdom of Bhutan attempted this starting in 2010, so that was the first nation in my understanding that just said tobacco is not part of our society or culture. But they had to end this 10 years later because apparently it was very hard to enforce. In 2014, when I was Assistant Secretary of CVS Health, one of the biggest pharmacy chains in our country, claimed that you would stop selling tobacco. They said, we're a pharmacy, we're a health group. We don't think this is part of our mission. So that got tremendous attention, and their sales have done very well without selling tobacco or e-cigarettes. So we're waiting to see what Rite Aid and Walgreens will do. They haven't followed up, which has been disappointing to me personally, but hopefully they will. And then if you look at places like New Zealand, we were talking about New Zealand at dinner time. They've had an excellent public health profile in many ways, in COVID and others. They have had explicit discussion about all these strategies as part of a nationwide plan to drop tobacco prevalence under 5% by 2025. And then the final point is it time to now be explicit about talking about tobacco as a human rights issue? Of course, when I mention this, I have to mention my brother Harold Coe, who's another friend of the American Academy in Berlin, a world-renowned international human rights lawyer. He and I have talked together about this issue in forums like this, and he will opine that this is an industry that has claimed rights all along the way, the right to commercial speech, the rights for intellectual property. Shouldn't this be so high on the human rights agenda as a issue that's going to kill 1 billion people in the 21st century? So, as I end, I hope that when you see this quote, the enjoyment of the highest attainable standard of health as one of the fundamental rights of every human being, first that you ponder about what the highest attainable standard means. Think about how you can contribute to that discussion as a public health colleague. All of you here, regardless of your background, are public health colleagues. And then if we're going to be serious about this and make an impact, we've got to start with the big things that are killing people right now, pandemics like COVID, and then the forever pandemic of tobacco. Thank you very, very much.
I'll get things started here. Howard, thank you for a great talk.
Thank you.
A question based on a completely impressionistic understanding of the global fight against tobacco. My sense is, at least in the United States, but I think it's true in Western Europe as well, that the fight against tobacco was enormously successful for, shall we say, the middle, upper classes. Mm-hmm. You mentioned targeting disadvantaged populations, and you mentioned the homeless, but I think it's a lot broader than the homeless. Right. Mm-hmm. And just to give you an example, we lived, before moving to Berlin, in a university town in the country. Mm-hmm. And when you were in the university town, which is filled with upper middle class faculty and the like, you would never see a cigarette.
Right.
But if you go outside of town to the mall, where there are lots of people coming in from the countryside to shop, there is a ton of smoking. Right. And so the question I have is, has the effort to reduce tobacco consumption in the developed world lost some of its urgency because the policy class and the people who are most politically literate and engaged feel like it's been achieved?
What an excellent question, Dan. I can see why you're now president. Yeah, and it's absolutely right. You're absolutely right, Dan. So you're absolutely right. If you are of higher socioeconomic position in any society, the tobacco issue has shown dramatic progress, but it's now concentrated much more on people of low income, low educational attainment, and then these other targeted groups that you have seen. So, and there's so many public health areas where you see exactly the same trend. You see more affluent people benefiting from public health. You see the less affluent bearing the greatest burden. You see communities of color bearing a lot of the burden, which is where all the health equity discussions are. And then the other thing is that we've been successful at getting this off of TV and in public places in so many countries that people just don't see it anymore. And so it's still being used, but you don't see it. So you have now gotten to the nub of the issue that has continues to frustrate me, quite honestly, is that, I mean, why aren't we hearing about tobacco dependence as a forever pandemic every day in the news? I mean, look at these numbers. This has been going on for over a century. Look at all the preventable deaths. Where is the media? Where is the press? Where is the outrage? But the flip side is this is a chronic situation. It's not acute like COVID. At dinner, we're talking about how energized people get when there's an acute crisis versus a chronic one like this. And then the other thing is the tobacco industry has done a wonderful job saying, okay, well, you see somebody with smoking down the street. Well, that's normal. Everybody does that. It's been going on for decades, so why is that a big deal? And then they complicate it with their harm reduction strategies, as I've just said. So, Dan, your point is absolutely right. I would welcome ways to bring this issue back to light. Just last week, I didn't mention the FDA did announce they were going to ban menthol in cigarettes, so that got a lot of attention. It only took 13 years to get that decision made, but they're going through a comment period, and already the experts are saying there are probably going to be lawsuits from the tobacco industry after that. So this is a struggle. Every step of this is a struggle. We've made progress, but we've got a long way to go.
It looks to me very impressive on the progress in terms of smoking, even if it's socially divided in a certain way. Mm-hmm. But looking at this, have there been any observation as new dependencies on smoking have developed less? Are there other dependencies like alcohol or so that have compensated for it, looking at the psychological impact that people would like to get out of it? And on the other side, with the remaining smokers, if you've reduced the new dependencies a bit, what's been the most successful strategies of getting people off the cigarette?
Yeah, great question. So if you look at the issue of substance use disorders more broadly, it's a very challenging area because for tobacco alone, you have both combustible and non-combustible products. And then if you look big picture on substance use, you have opioids and you have marijuana and you have, of course, alcohol. During pandemic, all these issues got worse. I also happen to be a co-author in the Lancet North American Opioid Commission that was released by Stanford in February, and those numbers those deaths are going up dramatically. It's terrifying. So the combination of the pandemic, all these stresses we're going through has raised all these issues. Cigarette use has gone up too. So yeah, the ability of human beings to be vulnerable to substances is something that is very, very humbling, and we just have to try to understand it better, and then very importantly, try to offer people services, because too often there's a stigma, and we don't have the workforce, and then we have the overlap between substance use, tobacco use, and mental illness. It gets even more complicated, so we need the best mental health professionals to be involved in this too.
Thank you for this very fantastic talk of yours and for sharing your huge experience with us. We experience exactly the same problems in Germany. I'm on the board of Aktionsbündnis Nichtrauchen, as I said before, on the terrace. That's an organization of different health institutions, health organizations of the different experts, like cardiologists, oncologists, and so on. And the main problem actually we face during the last years, I would say, would be one, that we don't communicate about the problems in the press. Mm-hmm. Even though we're sitting in the politics and mention all the cases, which is 4 million in a long term, and speak about the financial issues, which is 98 billion per year of financial loss. The reaction of politicians or press doesn't increase. So my question would be, how actually, the thought is that getting politics involved is actually crucial. You were in the lucky position that you could force into regulation, but the political pressure that we can implement in Germany seems to be quite low, and the possibility to enforce regulations is it's too low actually to decrease the numbers of deaths per year. So what would your suggestion be? Which approaches need to be taken?
Okay, great question. So despite how complicated this is right now, a little bit of controversy is a good thing, actually. And actually, a moderate amount of controversy is probably not bad either. You don't want to be overwhelmed by controversy so that you're paralyzed. But it could be that this increasingly visible debate about e-cigarettes as harm reduction will bring in the press, bring more media attention. We could have a healthy debate with the common goal being to end combustible smoking, which is killing people at the rate of millions a year. This announcement by FDA in the United States last week to ban menthol cigarettes. I don't know how closely you follow this. I mean, most people say, oh, this is good. It'll stop smokers, particularly black smokers, from picking this up. There is some controversy in that. Some members of the black community say, oh, these are people who need these, and you're stripping it away and you're not helping them. So some very prominent people are on the opposing side of that. So that's going to be interesting to watch. So can we, as public health leaders and advocates, leverage these controversies and try to get the message out? Because in some ways, one of our problems, back to Dan's question, is everyone has heard these issues. It doesn't seem new to them. Then COVID comes along, everybody goes and looks at that for a while. In public health, there's always an issue that's getting a lot of attention while everything else is falling away. And, you know, it could be that as COVID, is it getting quieter? We will see. We're in a very uncertain time. A lot of COVID experts in the room. But maybe we can start paying attention to all these other issues, particularly around substance use that have been in the background and causing a lot of damage year in and year out. Hi, please.
Oh, sorry, I've got the
microphone.
Yes. I'll pass it back in a minute.
Sure.
Thank you for a wonderful talk. I felt like my life was flashing before my eyes, you know, sort of growing up in the 90s and 2000s and seeing all the changes that you talked about. Mm-hmm. And so to this question that Dan asked about this perception of success, and also a lot of what you were showing reminds me of some of the struggles we have faced fighting the oil industry, and which leads me to ask, do you see any lessons from your experience that could be applied for other industries that are creating public health problems? And related to that, do you see any scope for perhaps collaboration, allyship between the fight against tobacco and, for example, the fight for clean air, the fight against pollution, understanding that air pollution is also a major cause of lung cancers and other negative health outcomes?
Well, these are outstanding questions, so that's yet another one. So sadly, we see these themes over and over again. When there's an industry and business dimension, and by the way, I've written about how important it is for private business and public health to work together and have been criticized for it. So I am not anti-business. I think some of the best public health professionals I've met have been people in private business who really take this on. But unfortunately, when you have the exemplar of the tobacco industry, and then unfortunately with fossil fuel industry, as the science becomes more and more apparent, you know, the first reaction is always, you know, the science is faulty and this is flawed, and the goal is to just float doubt all the time until it just is overwhelming and people have to realize that you can't argue that way. So for climate change, if I can say, I think scientifically we're at that point, but then the question is, are you going to act on it? And can you learn? For tobacco, I've just reviewed the history. I mean, for years, the tobacco industry said, you know that famous congressional hearing, I do not believe nicotine is addictive. I mean, that wasn't that long ago, right? At least they don't say that anymore. But now they're saying we're a harm reduction company. You know, we're the good guys. You know, and putting out ads that way. So I think we just have to be aware of these trends that we see over and over in public health history, and try to call attention to the tactics of the industry when they need to be called out. So the last couple slides I just showed you about the new tobacco industry strategy about harm reduction, these paid advertisements, paid advertorials, that's pretty new information in the public health world, and we got to get that message out.
So I have the microphone now, and thank you for a great talk.
Thank you.
And that was a perfect segue to my comment and question, because it does strike me that I'm a historian, so I'm going to express a little bit of skepticism about the value of hitting on this as a human rights issue, because the analogy that I look to is the creation of a prohibition regime, a global prohibition regime of slave trading and slavery. And we used to think that this was a movement based on a push for the human rights of enslaved people, but now historians really see it much more as a struggle of governments worldwide to reduce the power, or what they used to call the petty despotism, of slave owners and slave traders. And so it was not so much about human rights, but it was about kind of calling out the cruelty and the excessive power of those intermediaries. So I just kept thinking about what's being normalized here is not just smoking, but it's selling harmful products.
Yep.
So the normalization is a kind of, capitalist project of selling harmful products. So what you just said in that comment just now really struck me as maybe the continuing fault line in this struggle, and that is just calling out the tobacco industry for doing what it's doing.
Right.
And my question is, do we know, has anyone measured how effective or what the impact was of those moments when the tobacco industry was exposed, when people really, for the first time, really heard that tobacco officials understood that they were selling a harmful product and making money from it? Did that have a negative effect on use or sales in a way that then we could seek to reproduce in calling them out for their current bad behavior?
Yeah, so thank you, Lauren. It's great to have a historian in the audience. So all the counter-advertising, the tips ads, the public health messaging, if done right, have been tested in focus groups, have been evaluated to see if they influence outcomes. And since I've been at this for decades now, when you point to what the tobacco industry has done in terms of their strategy and that they're trying to manipulate their products, what's in their combustible products, what's in their non-combustible products, and that their goal is to just keep their business going, that can be compelling for people who hadn't thought about it before. And we try to measure that and evaluate that in every effort we do. About the human rights strategy, I'm going to defer to my brother, I guess, on that. That's an easy out, right? But I think if that's a way to bring in more of the legal community about this issue, I think we need all the colleagues we can to try every strategy we can get. Is it easy? No. Will it work? I don't know. But I'll tell you this, the status quo continues to be absolutely unacceptable. And we're seeing too many deaths here. And we've tried all the empower strategies, and that's great, and we're seeing progress, but we need new ideas and an end game. We got to end this forever pandemic. So that's just something for all of us to consider going forward.
Yeah, I have a question. Do you know the number of people worldwide involved in the supply chain? Because for many countries, this may represent a significant decrease, if you ban tobacco sales, a significant decrease in their livelihood.
Yep, sure. Well, again, that argument's been used over and over. Oh, you're putting the tobacco farmer out of business. You're putting the small convenience store owner out of business. They make their money selling cigarettes. And so, especially for the tobacco farmer, there were a lot of efforts to support them as they transitioned into some other crop. None of this is easy. Leads to lots of political debates. But if you take on the argument, well, this is good for the economy and this is good for jobs, all you do again is first of all, you help the tobacco industry keep selling their products, and you don't help public health advance. And then most importantly of all, which is how I got into this, you see a lot of people dying when they didn't have to die, and they're dying of preventable illness. So yeah, so we have to be aware of those counter arguments, the economic arguments, the supply chain arguments, the workforce arguments, and then try to counter and then support people who are caught in the middle. Again, it's not the guy on the tobacco farm or in the supply chain who maybe it's the industry in the headquarters. It's got strategies like that, and they're smart. They've been keeping, how do you keep this going for over a century with a product that kills half of long-term users? That's hard to do, but they've figured out all these incredible strategies, and now they're moving into the harm reduction strategy, and that's going to keep them going for a long time. I just walked down around Wannsee over the weekend. If you wait for the bus, it's all e-cigarette ads there. Have you seen that? Just take a look. And so one of my colleagues here translated one of them for me and said something like, "You don't have to do ordinary smoking anymore. You use our e-cigarette product." Okay, that's what they're trying to do here. So even just a couple blocks away from here is an example of that. Okay. Hi, Lily.
Yeah, I have the mic.
Oh, I'm sorry.
addressing e-cigarettes, I'm always really surprised by two things, which actually the industry, I think, implemented in our wording. The first is the matter of that e-cigarettes would be less harming.
Yep.
And the second would be that it would serve harm reduction. Harm reduction, in my perspective, something doctors do, addressing people who are addictive, which would mean that e-cigarettes would need to be a medical product, which isn't proven at all. But we as scientists in the community actually have a habit to try to prove or not or disprove that this is actually true. Instead of discarding those wordings. And the second is having it or addressing it as less harmful would mean, is there less substance in terms of milligrams, micrograms in it? Is it fewer substances? Would it be less harmful in terms of symptoms? And which is also a wording.
Yep.
Could you kind of address this? Is
Excellent.
this something of the strategy that could be used
Yep.
to kind of discard that?
That's excellent question. So the National Academy of Medicine summary that said, we believe that these non-combustible electronic nicotine delivery devices have less harmful toxic products. that was very carefully worded. You don't want to use the word safe. You know the exposure is less harmful. But then also you don't know, I had another line in there, we don't know the long-term effect of e-cigarettes. So we don't know the health outcomes over the long term. We just know the product itself has fewer toxic products. So we're not quite sure what that means. And then your first comment really is excellent, because I've thought a lot about this. If you use methadone as harm reduction, it's heavily regulated. You go to a methadone clinic, you go to a health clinic, you go to a doctor or a hospital, it's prescribed for you, you track it carefully. But for e-cigarettes now, you just walk into some convenience store and buy it, and then the industry says, oh, this is harm reduction. So a very key point that you're alluding to is you need heavy regulation here. And by the way, if that is the future of e-cigarettes, the industry should say, we are going to prescribe this, we want to improve your health, that's why we're selling it. But you saw those ads. Are they talking about harm reduction? They're talking about take back your freedom, right? We're rising from the ashes, all right? That doesn't sound like a public health message to me. So it's very, very complex. So in terms of back to the US and around, I'm fascinated to hear what's going to happen in Germany and the EU. How many of these products are they going to authorize for marketing? Are they going to authorize any for tobacco cessation? And then what are they going to do with the overall environment of making these available to smokers to quit as a medical intervention? All of those are not well explained. I should mention as a quick add-on, the UK has taken this on in a very proactive, maybe somebody here can comment on that, but they're much more enthusiastic about using e-cigarettes as a harm reduction medical tool. So we need to learn from their experience too.
Yeah, thank you very much for pointing out again how strong the marketing aspect of smoking is. What you mentioned about the freedom, these happy people who are having fun.
Yep.
And I used to be a very heavy smoker for many, many years. And I felt like very much enjoying it because I was young and everyone was smoking and you could smoke everywhere and you had a lot of friends, all the other smokers and so on. And then I tried to stop, which is heavy for a smoker, as we use. And I stopped reading a book from this, you know it for sure, this English man, Alan Carr, who wrote Endlich Nichtraucher. And what convinced me was all of a sudden there was a person who didn't tell me that it was dangerous and that it will cause harm to me and my family and everyone. But he talked about life quality and he described how much better you might feel without smoking. And now whenever I look at, and I quit 20 years ago, and for me it was the best decision in my life because so I am a free person now. I haven't been a free person before. I'm a free person now because I wake up and I don't think about lighting on the next cigarette and all the terrible constraints you have when you're a smoker. But if I look at the programs, I always wonder if the progress don't focus too much on all and I'm a psychologist, so I think about motivation to quit. And all the things are about not dying. And it's a bit the same with the COVID thing now. Yep. We talk about you will not die if you get the vaccination, but it's about life quality. You are a freer person if you do it.
Okay.
And so I wonder what probably, if there are ideas about showing happy non-smokers who are free with their friends, enjoying and having fun. Because, of course, everybody knows that if you show an addict person who is addicted to anything and you tell them you will die from that, they're getting afraid. And what do? They take more of it. Yeah. They drink more, they smoke more, they eat more chocolate, they're getting beer because they are afraid. So I just wonder if there's an idea of programs, or you usually had this. What is with this positive motivation to leave something and have a happier life afterwards?
Right. Excellent. What a great way to end. So anybody who quits this terrible addiction has my deep respect. It's a magnificent achievement. I have talked to so many people who just can't stop. I'm so sympathetic, and it's not because of them. It's the industry knows exactly what they're doing by making these products and getting their next customers. By the way, the average age of starting smoking is 13 years old. Okay, so most people, I don't know how old you were when you started, but most people start because they're insecure about their appearance. They're about to go into the dating world. They're trying to be cool, that sort of stuff. All right, so if you can quit by yourself, that is a magnificent achievement. And then your point is absolutely right. I mean, we have seen through COVID, the message, get vaccinated, will save your life, may not move everybody. In fact, we need as many creative approaches as possible. I keep harping on the fact that we should regain what is normal, because what the industry has done is said, this is normal, this is glamorous, use it. We're changing the norm back. And again, this New England Journal piece that we published a couple of weeks ago with Professor Bloom and Bob Bazell, we make the argument that if over time we can say COVID vaccination is the norm instead of resisting it, this is the norm, maybe that's a more powerful way to get people to do it. And I think your point is great. Focusing on quality of life could be another way to bring in some people, not everybody, but we need all the strategies we can to change human behavior, keep people as healthy as possible, and have them reach their highest attainable standard of health. Okay. Thank you very, very much. Thank you.